second year DPhil students in EPAC medical division. It's great honor to talk about my DPhil research subjects. What does the B-type natriuretic peptides, BMP, those infectious reduce cardiovascular neurotransmission in hypertension? So first, what is hypertension? Everyone knows the hypertension, but exactly SBP is over 139, and the DPP is higher than 89, and that's if you check the blood pressure 3 times at the different times, or in the office or at home or hospital, we can say maybe you got high blood pressure, hypertension. And in fact, high blood pressure is very serious cardiovascular disease. It's also leads to the heart failure, stroke, and kidney failure. And the figure from the WHO, about 14% adult people got hypertension, but the 13% of people doesn't know they got this disease. And the worst thing is 9.4 million people dies because of hypertension per year. And from the clinical trial and the experiments indicates the autonomic nervous system is the relationship with hypertension, because we know there's the 2 pairs of nervous systems. The one is the sympathetic nervous system, and another one is the parasympathetic nervous system. I'm focusing on the sympathetic nervous system because the exciting of the sympathetic nerves, it can increase heart beating, increase blood pressure, and increase the metabolism. So, what's the BMP? And the BMP is released from the ventricle myocytes, and belongs to the peptides, the family. That's the 3 peptides: AMP, BMP, and CMP. And the BMP can decrease the blood pressure and is generally considered as a cardioprotective. And it may be used to treat in the hypertension and heart failure. However, from the clinical trial, it's quite disappointing, which it will suggest enhanced sympathetic activity, and that's the 2 main papers demonstrated that's the very, very disappointing results. So, but our lab previous research demonstrated that BMP can decrease the sympathetic activity through the NPR, CGMP, and the PKG pathway, and we can say that's the pathway. The NP binding is the receptor NPR, and the active the CGMP, and activity is the PKG. The both function is the can relax of the muscular muscle and decrease the calcium and the noradrenaline release, and can decrease the heart blood pressure. But the things is we are focusing is the PDE2. PDE2 is the enzyme belongs to the enzyme family. It's that's the family has 11 isoenzymes, and the main function of this enzyme is hydrolysis, the CGMP to 5-GMP, and also is hydrolysis, the CAMP. That means it can increase the calcium and increase the blood pressure. So my research as the hypothesis, we think is the BMP lost the function because of the impairs the NP-CGMP signal pathway, And also, I would like to identify the difference in the ability of BNP to modulate the stimulation of noradrenaline NA release in 4 weeks SHR and WQY. And the WQY RAS means the normotensive is normal RAS as a control, and the SHR RAS is pro-hypertensive RAS. And the main techniques we apply in these projects. First, I test the PDE2 activity between the WQI RAS, the normal one, and the pre-hypertensive RAS, SH1. And I use the gene transfer techniques in these projects. First, I take the sympathetic ganglion, the neuron, from the 2 types of the animal, and transduced with the empty virus. Empty virus means nothing, just the control. And the PDE2 virus means overexpression, the PDE2 in the ganglion, and the dominant negative, the PDE2 means it's a competitive inhibitor of the PDE2 enzyme in the neural pathway. Yeah, this is also the injection. Also, this is the injection, that's the virus in the atrium of the RAS. Yeah, this is the gene transfer techniques by atrial injection. Also, the 4 types of the virus were used in these projects. The MT as a control, and the overexpression, PDE2, and the also dominant negative, and the empty virus in SHR. And that is the general protocol of the noradrenaline release. And noradrenaline can increase the heart rate and increase the blood pressure. And I use the beating atria. I take the heart from the RAS and take the atria of the heart and pins in the chamber, and after incubates 14.5 minutes, and I stimulate the heart with 5 Hz for 1 minute, and the 18 minutes and 39 minutes. That's the right point means I use there's 2 peaks, and I use the BNP as the drug in the second peak. So I would like to compare what's the difference of 2 peaks after stimulation. And that's the main result. And we can say, first, we can say the PDE2 activity in SHR was higher than, was lower than SHR. That means the SHR has always exciting. Then SHR is the sympathetic neurons, and then we compare the noradrenaline release in WQY RAS and SHR RAS, and that's we can say BNP can decrease the NA release, but BNP didn't work in SHR RAS. We can compare the 2 bar charts. And also, I use the gene transfer of PDE2 virus to mimic the SHR RAS, and we can say that's the control with the MT virus, and then I use the gene transfer of PDE2 to overexpression the PDE2 virus in WQI RAS, and we can say the NA release increase than normal control. So that means the PDE2 play a very important role in the pathway. And then I also use the dominant negative, the PDE2 virus, transduced into the atria of the SHR RAS, and we can say that is the normal one. There's no big change between the 2 peaks. But after use the gene transfer, we can say the significant decrease in NA release. That means the also decrease the BP and decrease the heart rate. Also, I compare the calcium release from the sympathetic neurons and that's the general protocol describes. I use high potassium to stimulate cell to depolarization, and the calcium across into the cell membrane. And I use the BMP, and that's the BAE. BAE means the specific inhibitor of the PDE2, and we think BAE can inhibit of the PDE2 function, and that's the main result. And we can say is WKY that's the control, and the BMP can decrease the calcium release, and the different concentration, 100 nanomolar and 250 nanomolar. And I also use the BAE, we can see the decrease compared to the control. And in SHR, unfortunately, this BMP doesn't work, doesn't decrease the calcium release in SHR rods, in hypertensive rods. And then I use inhibitor of the PDE2 BAE and with the BMP, and we can see, of course, in WKY it can decrease. Also, very, very important things that's I use the BAE with the BMP can decrease the calcium in SHL rods. That's the confirm our hypothesis. The BMP with the BAE can inhibit this pathway, and the BAE, after use the BAE inhibitor of PDE2, the NA release, the calcium release, both are decreased, and that means the BP decrease, heart rate decrease. Okay, that's that's the conclusion. And based on those experiments, we can say the BMP can reduce the calcium transit time, and the NA release in normotensive rods, WKY, and but it's not in SHR because the single pathway was impaired, and we can say if we use the PDE2 inhibitor, we can find the calcium decrease and the NA release also decrease. And after use the gene transfer of overexpression PDE2 in WKY, we can say that's the calcium release and the NA release both are increased. So that's the result suggests co-use of PDE2 inhibitor BAE with BMP may provides the new way to treat this heart failure and the hypertension in the future. Okay. Thank you, China Oxford Scholarship support me studying Oxford, and the British Heart Foundation, Wharton College support me.